Medical Mission Award-winning doctor, Dr. Ini Uko, who worked around the medical consultation unit to ensure qualitative and critical examination of the patients, fostered the effective medical mission.
Okay, the young man has an abscess on his left lower extremities. So the treatment for abscess is usually incision and drainage, that is I&D. Again, you can add antibiotic depending on the situation. The fact that this abscess has been around for a little while, so I open it, drain it, and then pack it. Is going to pull the packing out tomorrow after 24 hours, and then I'm going to also give him antibiotic for 7 to 10 days, and that should take care of it.
There were many who testified about the potency of this exercise.
I personally welcome Oron Development Union Medical Services done here in Mbo today, 6 January 2014. It's great. It is wonderful.
And attended to, right?
Yes, and they care for me seriously, more than my expectation.
What did you go home with?
I went home with enough drugs prescribed by the doctor.
The greatest thing is really appreciating, really call us. Oron Development Union give this free medical treatment. I mean, and also I can name in the same in the sick. And I was a man of sick with that it is a sharp.
I don't know.
Eligible registration was appropriated in an orderly manner with rare decorum. Effective checkup, screening, problems history taken, weight check, different types of testings and counseling, such as blood pressure, blood salt sugar testings, HIV and AIDS testings, and optical testing. All these were preceded by medical consultation for diagnosis and examination, problem finding and analysis by sound medical doctors at Medical Consultation Unit. In some cases, some patients were referred for advanced attention, surgical operations, and follow-up.
They were able to give them drugs. Those who had surgical cases were referred to the nearby general hospital, and those who were HIV positive were also given referral notes to see the nearby hospital where they would be receiving medication.
While some were directed to collect lenses and reading glasses for their eye defects suitably. To crown the processes, all the patients always converge at the pharmacy, where the task is as serious as a race, with great pressure. But trust the pharmacist's daring. They worked tirelessly with winsome smiles, just to save humanity.
Quite hectic, as we would have expected anyway. But I have super professionals in doing the job.
Overwhelming but fantastic. Yeah, initially the crowd were trickling in, but later on in the day, the crowd extended beyond what we expected, and we're happy to see them. We ask God to continue to bless us and bless those people that have contributed to this selfless act. It's very tiring, but it's a labor of love, like I've always said. So we want to do this for our community.
It's a special grace from God. We will try our best to satisfy everybody around. Thank you.
About 350 patients and beneficiaries receive up-to-date drugs to their joy and satisfaction. At the HTC unit, 195 patients were tested, 168 negative and 27 very reactive, showing positive, showing the area as a minor danger zone of HIV and AIDS prevalence. The villagers are said to be predominantly fishermen, fish traders, riverine hustlers, and peasant farmers who live in ignorance of standard elderly living. Day 3, 7 January 2015 at Oron government area, medical mission volunteers reconvened to administer free health care to the people of Oron. The medical mission started with fellowship, familiarization, and the medical treatment orientation to help direct the patients on how to access the medical facilities and treatment at different units. Though the people cooperated, there were a few restrictive challenges among the participants in the case of getting their numbers or being attended to at the registration unit. The struggle of being attended to first is always cast by the impatient participants and those who return from the farm and market in the afternoon. They came in great number, trying to cause problem, confusion, beckoning on more registration just to take the exercise backward. The volunteers, through human and resource management skills, tamed and calmed the situation. At Ekum, the registration was perfectly controlled, at the end of which helped in trimming the crowd and the patients were attended to appropriately. The people were seen grabbing packs and wraps of drugs, clenching eyeglasses, and pocketing condoms in an exciting manner. Some were held back by Moon Media Expressions crew to speak and express their joy.
So ndimben eri no mi bok amori di kio ulokomo. So ndo ya baziori on Oron Union. Ano ngosa tama rongo ige anu. Ige meni se bok for amoke. For amemene ku sempre in Jesus Christ.
Mbo fia musanga la na bazi ko je di sia me biam. Ibra medie. Ne imbi bro fa. Ndam ko no ko mi ibra ga bazi mari umana me in Jesus Christ.
It is worthy of note that the 2015 medical mission instituted by Oron Development Union USA, supported by anti-rural resources, will ceaselessly remain evergreen in the minds and hearts of the beneficiaries. It speaks volume about the new era of love and hope in our nation, as it meets the needs of the people, their impoverished health conditions, healing bodies, healing sorrows, pains and wounds in a short while. Will still be called a vista of hope in human history, an elixir of life. Our safety, our health, our security, our very humanity depend on taking seriously the lives and fates of others. Members of Oron Development Union USA and others have discovered this in part, but for us who came down here have seen more and in whole. Take a look at this. Very common in Oron government area is teenage pregnancy, teenage parenthood. Seeing young girls with babies was quite pathetic. Teenage motherhood is a competition there. This is seen as clear ignorance of healthy living. This will definitely subject them to abject poverty, succumbing to anger, illnesses, and hazard.
I see so many teenage parenthood, teenage pregnancy, teenage mothers everywhere.
Yeah, it doesn't look like there's anything about family planning going on here. So they need more education and some kind of family planning program. Yeah, I mean, we've seen people as young as 15, 16, they can't even take care of themselves.
By this experience that we share, there is a need for effective sensitization and orientation on family planning and healthy living, as well as formal education. The people should be educated on how to plan family, live in good health, and to stay alive. Many babies, teenagers, youths and adults, men and women, fathers and grandfathers, mothers and grandmothers benefited from the 2015 medical mission at Oron government area, with the total number of 360 as beneficiaries. At the HTC unit, 85 tested, 75 negative, and 10 positive. Day 4 of the 2015 medical mission. In a crowded world, there is no longer a place that is too poor or too remote to matter. Everywhere matters. As it matters in Day 4, 8 January 2015 at Mubukokai for the medical mission volunteers to move in there to still save lives and provide sustainable hope of good and healthy living to the people. If it didn't matter, the village head and his council members would not have come out with refreshment gift and joy in their hearts to appreciate the medical mission volunteers.